Let me tell you a problem when we talk about the goal of treatment, and that is that many people have been depressed a long time. Many of my patients have been depressed for months or years, to the point that they may have forgotten what normal feels like. So the goal is to get patients back to what we call pre-morbid functioning, which means to get them back to the way they were before they got depressed. The problem with that is when you've been depressed for years, you may have forgotten what normal felt like. And what happens over the years is, I call it people changing their zero level. So they become used to being depressed, and they begin to accept that being depressed mode over time as being normal for them, because it may have gone on for months or years. And so they reset their baseline now, and they accept being depressed, say on a 0 to 10 scale, 10 being the worst. They accept 6 or 7 as being normal for them, and they begin to accept that and live with that and function with that day to day, so that they come to us for treatment when they get even more depressed. So now they're at 8 or 9, and that's when they come in. So when they get back to 6 or 7, they think that's normal to them. Well, in the language of treatment, we would call that getting a response. Response means you get better. Technically, it means you get 50% better than you were when you started, using some sort of rating scale to find out how severe your depression was. If that improves by 50%, we call that response. Response is good, but the goal of treatment is now accepted as remission. And remission means going back to the way you were before you became depressed. Being able to function effectively, getting rid of most of the symptoms of depression, and being able to enjoy life the way you should. The problem is that, as I said in the big study that just went on from the National Institutes of Mental Health, with the first treatment with an antidepressant, over a period of 3 months, only 1 in 3 patients got to remission. We've got to do better than that in our treatment. And psychotherapy may increase that effect, but even psychotherapy added to depression or used singly doesn't make depression go to remission in all patients.